Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that has helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our experienced clinical team, Dr. Paul Hrkal, Melinda Cranin-Hill, and myself, Dr. Cameron Marshall, we're here to share insights, empathy, and a clear path forward. In order to protect the privacy of the members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews and see if it's right for you. Whether you're looking for answers, hope, or just a little bit of encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
Hi, I have a question. So this is probably more like I don't know who should answer that, but anyways, I am symptom-free pretty much. I've done I'm 7 months out. The only time when it bothers me when I'm on the gradual return to work, and so what happens is if I'm working on the computer, if I have two screens, and if I'm talking to people, I get a headache. And I also noted that when I was off for a week, we had spring break, I was completely fine. We were out of town, this town called Whistler, just outside of Vancouver. So it's very peaceful and there's snow and mountains. And what was interesting is that last weekend I went back to Whistler, even though it was a pretty intense week. I was completely fine. And I did a hike. Like an 8-kilometer hike with snowshoes up the mountains, no problem. But when there's a screen involved in work, then I get a headache, and I'm wondering if it's a psychological thing, like if it's sort of anxiety driven. So hopefully that yeah, that's my question.
So it could be a few things. One, it could be a reflection of the screen itself. So screens have like a refresh rate, so you don't really realize it, but they're flicking at you. So they're flashing 60 times every second. And so that's very stimulating. And so it could be the screens themselves that are just creating kind of an overactivation. Now, one way around this is to actually get a screen that has a faster refresh rate. So there's ones that you can get that flash at 120 times a second, but it's kind of paradoxical because the faster it flashes at you, it makes it so that your brain can't perceive those flashes and it looks more static. So you don't realize it, but your screen is actually flickering, right? It's like a flickering light. So it could be just the stimulation of the screens themselves. And so you can try to get better screens that have a higher refresh rate. So you look for ones that have a refresh rate of 120 hertz versus 60 hertz. They can be expensive though. The other thing that you can try is some people find that it's maybe the blue light. So you can try like some blue blocking filters on the screen. Like you can get ones that go right on the screen. Like I have one that basically dims my screen and removes blue light after a certain time. But you could do that throughout the day. Like you could just have it set for that and you can see if that helps. You could also try blue blocking glasses for computer-based work. Sometimes that helps too.
I have those.
Yeah.
Yeah.
Do you wear them when you work at all?
I do all the time. And
so it still yeah. So that might not be the issue then. It could be the flicker rate. The other thing is it could just be neck related in posture, right? So when you're on a screen and you're sitting, right, you're going to
I got a stand-up desk. I stand up.
Either way. So you're standing, but as your eyes are moving and tracking and on the screen, it's engaging, neck issues. And so there could be just some lingering neck dysfunction there that triggers when you're doing ocular movement. So kind of a combination of things. Most headaches tend to be neck related in my experience. So it could be that when your eyes are engaging and tracking on a screen and you're standing in kind of a more sustained posture, you're engaging some of those neck muscles and maybe there's some dysfunction that's then triggering that headache. But when you're out and moving around and active, the muscle tissues warm up and so the tension actually reduces. So usually people that have neck related headaches usually feel better with exercise because it warms the tissues up and the tension drops. So it could be that. So I think a few things to look at would be the refresh rate of the screen. Maybe it's the flickering, or potentially there's some just lingering neck issues that are triggered when you're doing eye movement stuff, like standing in a sustained posture, but moving your eyes back and forth screen to screen. That way, those are the big things that jump out at me. I don't know if Paul or Melinda, if you have anything to add there.
I was going to echo that. I see this a lot in my patients, where they'll say that they go on vacation, they're not in front of their computers anymore, and their symptoms are dramatically better. In this case, it seems like you've isolated some of the things like the blue light. So that's good. You're using a scanning desk. You can still get some postural changes with standing. You get that forward neck carriage because you're obviously moving your head, but then also you're like kind of just, you don't realize it, but over time you're like kind of moving and inching forward. And that puts extra strain on that upper cervical neck muscle grouping. And so I think that most likely the connection is that your visual system and your ocular movements are connected to the cervical neck muscles. And that's contributing to your headache, where if you're out walking in a more relaxed environment, you're obviously not looking close. You're not looking in this kind of very static, moving side to side, up and down type of position. And your symptoms are dramatically better. So I see this quite often, and I just tell people they have to go back and really, if you have a provider, go back and ask them to look at that area of your neck to see if they can address that.
The other thing that jumped out at me is potentially eye strain, right? So you're just talking about like looking near to far, right? If you're out in nature, you're kind of able to expand your gaze and you're not focusing on small print and those types of things. So I don't know if you've been to an optometrist recently to look at like your near vision.
I do vision therapy, so they're on it. Yeah, like I do that.
So does that make your symptoms worse when you do vision therapy, or better?
It doesn't change. Maybe I don't like it. It doesn't impact me that much. There's certain exercises that I do that bring on the symptoms, but if I keep doing them, then I build up tolerance.
Right. Yeah. So the fact that you do get increased symptoms with certain eye exercises kind of points me back to neck, because that's usually kind of what happens is that when your eyes are doing certain things, if it's engaging neck dysfunction, then it could be coming back. Are you getting any neck treatment?
Yes, as well. Yeah. No, I do the exercises and I have massage and I CPT. I've got like the laser exercises. Those I'm doing those too.
So those are proprioceptive, but are you getting like good soft tissue work?
Yeah, I get massage. Yes. Yeah, and my PT works on my neck as well.
Yeah. So have you gone through the manual therapy videos that I did?
In the class, yes. Yeah. So
in the resources.
Not those. So maybe
if
you could
go look at that, because what happens, like sometimes massage tends to be more like surface level stuff, but usually these dysfunctions are deeper down. Like in the front of your neck, for example, is a big one. In like muscles that massage typically doesn't touch at all, right? So massage may not be the right treatment for what you actually need to do this. So if you go into the resources, I have 2 videos on manual therapy, part 1 and part 2, where I kind of walk through like what you're looking for, and you may just realize that you're missing some of those components, and that might be the thing.
Okay. Sounds good. Is it also a mental component, like a psychological component? That's the question for Melinda. So if I get a headache, then I get like anxious, and then it increases my headache.
Yeah, I mean, you mentioned the anxiety at the start and wondering if that was a component. So it might be, what have you observed? If you observe that you do get anxious when the headache comes on, it might be more of like a perpetuating factor. So for example, if from neck dysfunction, you're experiencing more symptoms like the headache, and then you start to worry about the headache, or you start to get anxious about the headache, then it can actually create more tension and then exacerbate what you're already experiencing. So that tends to be the pattern we notice most when it comes to symptoms and symptom exacerbation. So that could be it. I mean, is there anything else you wanted to share with us with regards to like how the stress manifests after, or what you notice about anxiety?
Yeah, like if I get a headache, then I start thinking, I'm like, oh my God, why do I have a headache? And then I've almost had a panic attack a few days ago.
Yeah. So right, that sense of like getting really worked up by the symptom might be sort of going back to the recovery mindset module, reminding yourself that even though I'm having an uncomfortable symptom, it doesn't mean it's unsafe. It doesn't mean it's dangerous. So reminding yourself that you're having this experience that's unpleasant, that's uncomfortable, that's painful, but it doesn't mean that it's dangerous. That's that idea of decentering. We're looking at moving away from and disidentifying from the symptoms so that things don't blow out of proportion and become this sort of panic cycle, because that only makes everything worse, right? Then there's just like so much more tension in the body and we're just stuck on this hamster wheel of worried thoughts. So recognizing and maybe going back and refreshing your skills on how to step back from an uncomfortable symptom and just start to see it as just that. It's an uncomfortable, unpleasant symptom. It's not permanent. It does go away. There's certain times during the day when you don't actually have that symptom anymore. So it's a reinforcement. You have evidence to say that this is an impermanent experience. So reminding yourself of that, and that when you experience it, it doesn't mean you're in danger. You're still safe. It's just this sense of, oh, okay, I'm having an unpleasant experience. What can I do to support myself in this moment? What I'm hearing is sort of going right into that anxiety spiral. So seeing whether you can use some of the skills from the recovery mindset to decenter and start building up a different maybe language or narrative around what that painful symptom means. It just means it's uncomfortable. It doesn't last forever. Can I bring that into my self-talk?
Okay. Is there any specific things that, like, I work with a counselor, like EMDR, or is there like anything else that I should look at to work with this? Like, I wonder, because it's probably like trauma related, right?
EMDR is trauma processing therapy. I'm not sure from what you've shared with me. I mean, of course, there might be lots of layers I'm not aware of, but from what you shared with me, I think just more simple CBT, ACT is something called acceptance and commitment therapy, which we cover in the program. These all have skills on psychological flexibility, ways to disidentify with our unpleasant physical symptoms that come with PCS, and how to start shaping that so that it doesn't feel all consuming when you do get these symptom flares. And the more we can manage that and start to see our symptoms as just symptoms that come and go, we become more psychologically flexible and resilient. So that's kind of right in the beginning of the recovery mindset module. You could even go through it with your counselor so that she has a sense of what I'm talking about if it's resonating.
Okay, great. Thank you so much.
Okay, next up is
I'm kind of, I've hit this plateau. I've worked with a chiropractor who really did some great full body work. Like I mentioned, I think the last time I spoke with you guys, I was able to go from only being on screen for about 50 minutes, and it felt like almost like he flipped a switch when he started adjusting my neck, like around C2, C3, and C4. It seemed like after that, I was like, oh, wow, I can, double this time. So now I'm able to do like 2 hours and change on screen. I spoke with him yesterday and I was like, where are we at? Like, how do you, like, is there anything else you think you can do? He said, no, he thinks he's worked on everything that he could, see would be an issue, that now my alignment is good, et cetera, et cetera. So this person, is not really a headache specialist, I guess. And so I feel like it's like the same questions I feel like the last person was talking about too. It's like, I don't know, could there be other factors here? I noticed that sometimes when I drink coffee, like I get eye pressure easier. I don't know. That's just a side note. I guess I'm just a little frustrated and kind of now I'm going to go try to find a new chiropractor. Um, but yeah, I don't know. Is that normal to have an adjustment and then, you know, I'm able to increase the amount of time like that I'm on screen, but is that something you typically see, Dr. Marshall? I know you've talked about working with patients and you really work on them, and then it seems like you're able to alleviate, you know, the eye pressure headaches, you know, pretty quickly. So I don't know what I'm really asking, but I just want to know if you have any thoughts.
Were they doing just adjustments with you?
No, they were doing ART. And I went to somebody else who was doing ART for a while too. Like I think that guy was not going in deep enough, but this guy seemed to be going in pretty deep.
And were they getting like all around? Were they working on the front of the neck and the SCM and the scalenes and all that stuff?
Yeah, yeah.
And were they going down chain as well, like looking at, you know, stuff in your shoulders and your pecs and your hips and
Yeah, so we did work in my hip, we did work in my shoulder as well because I have old injuries, so that was like something I mentioned to him in general.
Mhm.
It wasn't like he worked on every single body part in every single session, although he did many different body parts in a number of sessions.
Now, when you do like the VOMS assessment type stuff, does that trigger any symptoms?
I because it's been a little while since I've seen that. Is that like looking left to right?
Well, if you go to the module on dizziness,
Uh-huh.
right,
Uh,
in the program, there's kind of like a self-assessment. So, if you haven't done that in a while, I would go back and do that because it may be that now the neck is clear, but now you're left with the visual component. And that may be it, right? Like it may be again the screen refresh rate that we were talking about earlier, that's the thing that's still triggering you. Whereas now the neck is doing pretty good, but you're still having this like issue with refreshing, or maybe you have some ocular, you know, like a binocular vision disorder situation that needs vision rehab. Um, so it may just be like, you know, you've pulled on the one thread and now you've kind of hit the plateau. The people you've seen tell you that everything is pretty good. So now maybe you're left with, all right, the visual vestibular side. So maybe if you go back to that module and kind of reassess on the VOMs and try to see if that triggers anything, that may just give you some ideas in terms of exercises that you can try to do to see if it helps. Or maybe you need to find a neuro-optometrist to see if there's any vision issues that may be contributing to that.
mm, isn't would a neuro-optometrist just like I just had an MRI done and there's nothing significant in there, but is that what they would do? They would run
No,
the
no.
no.
They would do like a general ocular assessment. So they would look at like a standard optometric assessment, right? They'd look at visual acuity. They would look at, color vision. They would look in your eye and see if there's any issues with like your retina or, things that are in the eye, any eye disorders like that. Then they would move into more of a functional visual assessment where they'd look at your ability to, expand your gaze and see peripheral vision. They would look at how well your eyes can converge, how well they track back and forth, how well they work together. Is there any misalignment in terms of, one eye may be sitting slightly higher than the other one and you're getting some overlap and that's causing strain. And so they do a whole bunch of things. It's not just standard optometry. It's like you want a neuro-optometry person because they will do standard optometry plus they'll look at binocular vision, meaning how your eyes work together.
Yeah, I've been working with the SUNY School of Ophthalmology or wait, ophthalmology. And
So
I've been
that's
going to
different.
visual therapy. That's different.
That's different.
Okay.
Yeah, ophthalmology is basically it's a medical doctor that specializes in the eyes. So they're looking for pathology in the eyes themselves. This is different because if they find that there's no pathology in the eyes, that's great, but it's how are the eyes working together?
Right, but those are all I'm probably saying it incorrectly, but all of the exercises that I'm doing with my vision therapist.
Oh, so you are
It's
doing,
I am.
yeah, okay.
Yeah.
Okay.
And so like the thing too is I've improved with that therapy. Like everything is just, it is getting better, but there are certain exercises that trigger symptoms, and I'll be like either a little nauseous after it or just exhausted, that kind of thing.
Mm-hmm.
So I don't know. I mean, like I'm definitely down to try a neuro-optometrist if you think it's going to be.
It sounds like you're maybe already seeing one based on your description.
Yeah.
So yeah, I mean it's increasing exposure. Sometimes these things take a while. Like it sounds like things are improving, but they're kind of slowing a little bit. So I mean, it sounds like you're on the right path.
I think I might just maybe I will just try. I think I was going to do this anyway, but I think I'm going to find another chiropractor. I found someone online who seems to have headache experience, or like strong headache experience. So I'll try that.
Sometimes it's just a different set of hands,
Yeah.
right? Like I have patients that I'm like that my stuff doesn't work, and I refer them to an osteopath who has a completely different way of doing things, and the patient gets better. And so that's fine. So like different hands, different approaches. It's a lot of trial and error, and sometimes it feels like it's, 2 steps forward, 1 step back kind of thing. But you're progressing, which is really good. And so a different set of hands might just unlock something that wasn't unlocked before.
Got it.
So it's worth
Yeah.
a shot. Like, I always say if you've seen one chiropractor, you see one chiropractor, right? Like you gotta kind of, because it's so practitioner dependent and patient dependent. So it matters, like the right patient with the right practitioner can unlock things, but sometimes you hit a plateau and then a different set of hands, all of a sudden, like boom, they get to a different area that this person never did. And whoa, it accelerates things a little bit more, right? So, I mean,
Got it.
I'm a chiropractor, but I refer to other chiropractors all the time
Got it.
because what I'm doing, for some reason, I'm missing something. So I go, you know what? Try this guy. And that's fine. Like ultimately what I want is the patient to get better. And so if someone's plateauing with me, I'll say, you know what? Try this approach and send them to somebody else, and maybe it unlocks it.
Got it. Okay. Yeah, I'm gonna go do that then. The last thing I was thinking about trying to slowly run outside because this is like months and months and months ago. I had visual issues and kind of vestibular issues from doing that, and I thought it might be neck related. Do you think? I mean, like, I was just gonna try and see what happens, like very slowly. If it's neck related, vision related, I mean, does that sound like it's a bad idea?
No, it's actually therapeutic. It's actually good because
Okay.
what you want to do, like, it depends. Have you been able to exercise fully?
Yeah.
So you don't have any increase in symptoms when you exercise?
Well, since I had that neck adjustment, like the teeny tiniest amount of eye pressure sometimes now, but not every time I do cardio.
Right. So basically, if you can get to full exertion, right? Like you can exercise at, 75 to 80% of your max heart rate for 20 to 30 minutes, and you don't have any significant increase in symptoms, meaning you're not getting a 3-point increase, then that means that autonomic is fine. So the one thing you don't want to push into with concussion is that autonomic nervous system. That's the one thing you want to kind of make sure you're being sub-symptom threshold. But if you've proven that you can exercise and you don't have a threshold, meaning you don't get that significant symptom increase, then that's good. Then everything else, like if you exercise and get an increase in symptoms, we look at that almost as therapeutic, right? If you're running and you're getting like visual motion, you're actually exposing yourself to visual motion, which is actually good. That's what you want to do. So with vestibular and ocular motor stuff, the treatment is actually, you want to be pushing into symptoms a little bit. But with exercise, if you're getting symptoms due to the exercise, that's where you want to pull back and be below symptom threshold. But everything else, having a bit of symptom increase is actually therapeutic because you're increasing your tolerance to it.
Amazing. That's everything I wanted to hear.
Yeah.
Okay.
So as long as you can exercise in like on a stationary bike or something, now you know it's not autonomic. So if you go out and exercise outside and you go for a run and your symptoms increase slightly, that's actually good, because the more you do it, that will subside, and that's you're training your brain to be able to handle, visual motion, for example.
And that's just the brain doing its thing and like being rewired in a way.
It may be the brain. We don't know if it's the brain or if it's just sensory integration, right? So it's like maybe visual motion is like an issue for you that causes you to be a little bit off. Like, let's say your eyes are not giving correct signals compared to what your neck and vestibular system are saying. So is it actually a brain issue, or is it an input problem? I tend to look at it more as an input problem, but by training those inputs and challenging those inputs, then you get better integration because you get used to those types of stimuli.
Okay, perfect. Thank you so much. This is really helpful.
You're welcome.
I'm going to hop in there before we move
Sure.
on. I'm kind of delayed in this part, so hopefully it still resonates. But the other piece that I was thinking about was sometimes the pressure we have on getting well quickly. And so there's that live I did around The Power of Maybe. I believe that was the title of the live, and I thought it might be nice for you to watch it, just for a sense of like, hey, is there anything mindset related that might make me be feeling extra discouraged or extra frustrated about this journey that you're on? It makes sense to feel that way, but sometimes in certain aspects of the way we think about our journey can actually hold us back a little bit because we're feeling so discouraged. Why am I not getting better? Why can't I find the right provider? Why can't, this make more sense? Or why is this such a puzzle to put together? So it's just a little a live that has a bunch of tips and tricks on how can you support your mindset to continue to move forward with these different elements of rehab in a way that's a little bit more lighthearted. So you're not feeling that, I went to another provider and now this isn't working, and I've tried this and now this isn't working. It's just a way to say, hey, what's the next step? I've learned everything I can from provider A. So let's move on to provider B, and what can I glean from them? And just, adding a little bit more lightness to it.
Got it. What did you say the name of is it under the resources section?
Nikki's put it in the chat for you. It was called
amazing.
The Power of Maybe, March 23rd, 2023, and it'll be in the resources section.
Thank you so much.
You're welcome.
Okay, next up is.
Hi guys, thank you. My question is, so I've tried, to your point, like lots of different providers and like types of manual therapy for my neck, and I'm just wondering if you have any tips on like how to choose a good provider, both in terms of like specific individuals and like types of providers and therapy.
I would recommend you go to the resources and look at the manual therapy videos that I did. So manual therapy part 1, manual therapy part 2, because I break it all down in terms of the symptoms as well as different provider types and what they do. And then I have kind of a flow chart there for trying to find the right person for you. So I think that would that's the best way I can answer that, is just to go and check those out, because I think you'll get way more out of that than me trying to reiterate that here.
Thank you. Does that also include like neck hygiene exercises, stretches, things to do on your own? Cool.
Yeah, it does. The problem is like that stuff is, you can do that. Like that's also in the course as well, but that stuff isn't as good as like actual specific directed treatment for your issue, right? Like I don't know what your issue is because I can't put my hands on you. So we basically give some general stuff, but is that going to be effective for what you're dealing with? I don't know. It's better to, look through that, say, okay, I think my issues are here, so this is the provider I should probably be looking for, and then they can help direct you based on your specific kind of situation, right? What I find is that if you've done all the manual therapy stuff, then what you could be dealing with is more of like a stability issue. If like things aren't holding, or maybe you get a little bit of temporary relief, but then it comes back right away. Oftentimes there's these kind of stability issues. And so you may need more, PT, rehab, exercise type. So it just really depends on where you're at and what you're currently dealing with.
that makes sense. And that kind of answers my follow-up question, which was like, yeah, once you've found the right provider and treatment, I assume it's a case-by-case basis. Like, if you need that ongoing, how long you need it ongoing, and then like, yeah, what your personal maintenance is to.
Yeah, like, I mean, I'll show this. Let me just share my screen. I gotta find it first. But so this is from the new kind of Concussion Fix program that we're currently refilming, right? So, all right, you get a sneak peek here. So basically, like, you think like, okay, here's the treatment volume and type. Now this line right here is like symptoms. So having maybe headaches and dizziness. So at the start, the most volume of treatment is going to be manual therapy. So that's the blue, right? So most volume of manual therapy is going to be here. As the headaches start dropping down and the symptoms are reducing and getting better, then the next thing you want to start adding in and increasing the volume of is proprioceptive rehab, which is kind of integrating the visual function and the vestibular function and the neck function so that they're telling you the same signals. Then shortly thereafter, you want to start beefing up the stability because you want to be able to hold things, right? As now pain is coming down, symptoms are coming down. Now you want to work on strengthening to kind of keep things there so that it doesn't come back, right? So you want to try and strengthen your neck over time. So that's kind of how it goes. So depending on where you are on this curve, that may dictate where you should be at. I don't know. Does anything jump out at you here? Like, where would you say you're at along this?
Yeah, I feel like I'm at the point where I would like benefit from all of them. So yeah, like
Right.
close to where like that the red line intersects the blue.
Right.
And so what I hear you saying is that the stabilization rehab is like specific to each person and their issues. There aren't like universal exercises that
I
are
have
helpful.
I have basically like universal type exercises in the neck module.
Okay, cool.
So there are stabilization exercises in there. Stabilization is more general, so you could use those exercises. But the problem is that neck rehab just as a whole is not super good. But in the manual therapy part 1 and part 2 series, I talk about some other types of treatment. Now they're very difficult to find, but maybe you could find it. But it's things like dynamic stabilization exercises with something like the Topspin 360, which is like a football helmet with a rod on it. And I show some videos of that. That works really, really well. The research on it is incredible. It surpasses by far any traditional kind of neck rehab stuff that we do. So you'll see kind of what that is and kind of how to maybe find it. But yeah.
Thank you so much. This, if there's not a quick answer to this, you can just say pass and I'll ask on a future call. But during your last answer, you said that the autonomic nervous system is the one area where we don't want to push into the symptom threshold. And I was wondering if there's a quick answer to like why that is.
Because if you think about your autonomic nervous system, you have the two components, right? You have fight or flight, and then you have kind of rest and digest. Now, the thing is, if you push too hard into that, it actually dysregulates further. So it's about creating this balance where you're challenging it a little bit, but you're not going into that threshold, because when you go into that threshold, your body reacts by further increasing fight or flight. Right? So if you're surpassing your threshold constantly, what happens is it's almost like you're running into a wall and you're going to get just pushed back. And then sometimes that creates a massive setback. And then you have to start all over again and build back up again. So that's the one area where you want to just stay kind of below that threshold to try and move the wall further away from yourself rather than bashing into it.
So when you exercise to a degree that you get symptomatic, you're pushing into that.
Yes.
Okay. Thank you so much.
So what you want to do is you want to exercise and find out where the threshold is. So you go and you push and find out, okay, I have a 3-point symptom increase. That's my threshold. What's my heart rate? I want to stay at 80 to 90% of that heart rate when I exercise so that I'm not hitting the wall. I'm below the wall, and I do that for 2 weeks. And then I re-challenge it again to see where it is, because now the wall has moved. I can get to a higher threshold. I can do more before that symptom starts. My new threshold, what's my heart rate? Great. Now I pull back 80 to 90%. I stay there for 2 weeks. Then I re-challenge it. And pretty soon you'll get to a point where you don't have a threshold, you can get to full exercise and you don't have that symptom increase, great. Now you know you fixed it. But if every time you exercise, you're hitting that 3-point increase, you're basically challenging yourself day in and day out. And what happens is you're actually further dysregulating, and that wall starts getting closer and closer to you, where you hit your symptom threshold earlier in your exercise. So it's counterproductive to do that. Whereas with rehab, like vestibular stuff, it's actually considered subtherapeutic to work below your threshold. You actually want to challenge your threshold with visual and vestibular, because then that's what moves the wall. But if you challenge yourself below that threshold, like if you were to take the same approach with visual and vestibular and work below threshold, the wall actually gets closer to you. You actually are able to do less and less. So it's kind of two different ways of doing things. So with Autonomic, you want to stay below it and challenge it every so often, every couple of weeks. But with visual and vestibular, you actually want to challenge it regularly.
Thank you.
You're welcome.
All right, I think we're going to go to some questions. Nikki.
So the first one is, Dr. Hrkal, my face seems to be a mess. Since doing the diet, my skin started to break out a lot more. I know skin is the biggest organ and detoxes. Part of it, I think, is my hormones, which I have seen my naturo about, and we have tried eliminating things like pumpkin seeds, removed cinnamon, cayenne, and milk. Didn't change. Taking Vitex did help a bit short term with women's scent supplements. I don't use over-the-counter creams or face cleanses, only oils like small amounts of jojoba or castor that are good for the skin. I also started to get a sty in my one lower eyelid every few weeks. It goes away quickly in a day or two, but then pops up again a month later. I also have a small water cyst in the corner of my eyes, one eye worse than the other, which my optometrist isn't worried about. She said it may be annoying due to the location, but not worth the surgery to remove due to location. Is this, do you think, hormone related? I tested them and they were in good range for my naturopath for a very start of perimenopause. Just wondering if you had any ideas on what I could try. I feel like a frustrated teen, but in my 40s. Mm-hmm. And then they did message back real quick afterward and saying they also don't wear makeup unless absolutely needed and washed off instantly afterwards.
Okay, so it sounds like the change in facial acne, it sounds like what it is that occurred after starting the diet. So I'll just explain, just based on my clinical experience, is that most people, I'm going to say probably 9 out of 10 people that start a diet like the Concussion Fix or a similar one, anything that's more healthier, that's cutting out the obvious highly processed foods, increasing some of the healthy, nutrient-dense foods, they're going to notice improvements in their skin. They're going to notice improvements in their energy. And 10% of people have what you might kind of call a paradoxical effect or the opposite effect. And that might be, we've even had these questions in the course before where they're like, my energy is worse after starting the diet, or it might be my stools have changed and I was regular before and now I'm constipated, or now I'm loose. I think that there's an adjustment period for that 10% of people as the body may be, as you've pointed out, eliminating things. The skin is a backup or tertiary detox organ. Primarily it's liver, kidneys, and the gut via the lymphatic system as well coming out of the body. So if a person gets acne after following the diet, the first thing I'm looking at is there something that you've included in the diet that you weren't eating too much before, even though it might be a health food that could be causing something? So, for example, you were now eating more dark chocolate because you cut out some other refined types of foods. This is just one example. So first thing, observe and reflect on anything that you could increase. And it could be more nuts and seeds. Some people are sensitive to these things like the other naturopath was doing. And so there's a bit of trial and error. Generally, cinnamon, cayenne, pumpkin seeds don't cause that. Those are very hypoallergenic foods in my experience, but definitely dairy products. But it would only really make sense if you somehow increase the amount of dairy products that you were consuming rather than keeping them the same. That's number one. And so that takes a little trial and error, looking at some of the things that you might have added in. Secondly, we go down the detox pathway, where it's like, okay, so if you're having acne and having some of these other symptoms, making sure we have adequate hydration to support detoxification, and then talk to your naturopathic doctor about supporting liver, because the liver and via the digestive system as well is very important when it comes to metabolizing hormones, metabolizing anything that comes in through the diet, and eliminating. Sometimes when we get on a healthy type of diet, the body has a chance to eliminate more. And that's where you get some of these detox symptoms. What I do with my patients, and hopefully this is what your naturopathic doctor will do with you, is that I say, okay, once we've evaluated all those things, I'm actually going to help your body eliminate better rather than trying to suppress things, which I'm glad you're not putting things on top of it and suppressing it. So that's number one. The second point about the hormones, I don't know why all of a sudden after you implement the diet, you would start getting hormonal changes. Again, normally there's improvements. Generally, acne is not a symptom of perimenopause or in your 40s. So that's why I really left the hormones to last, because I don't think that that's probably the main issue. Unless for whatever reason, there's an increase in androgens, which is testosterone and DHEA, which again, I don't see a reason why that would increase all of a sudden after starting the concussion fix. So I really would go down the possible food sensitivity addition that you weren't maybe expecting, something really just uncommon. And secondly, down the detox pathway.
Great. And would that help with the dye and the cyst? Would that also?
Yeah, any sort of cyst is an accumulation of liquid and substance from the body. And so that's oftentimes these cysts can be benign. They can, that's why the optometrist doesn't really worry about some of these things. But again, it's the body putting things in the wrong place, if you want to think about it really simplistically. So if we go back to supporting the body's detox pathways, and again, I mentioned the three main ones, and I think this is really important to understand. Adequate fiber for the gut, so that's a really important way of detoxifying. Increasing hydration, and then making sure there's something to address liver, something to address kidneys, and something to address your lymphatic system. Those three things. And sometimes we might use a combination formula that has either homeopathic or herbal remedies that address either one of these, that address all of these things I just mentioned.
Great. We do have another question here in the chat. I had my concussion January 5th this year, was feeling really good, and started to get back to all my activities, skiing, biking, etc., with very minimal symptoms. I had a small accident while skiing on March 9th, and I kind of scared myself that I got another concussion. I don't think I did get another concussion, but maybe scared myself that I would. Now I'm having a lot of difficulties getting back into activities. My question is, does Dr. Marshall think I would have gotten another concussion, or is this mental? I'm doing a lot on the mental side and it's helping a lot, but I keep having setbacks. Thanks. And I know, Dr. Marshall, you mentioned the concussion cliff, which I did also link in the comments, where they can learn more about the concussion cliff.
Yeah, and what do they mean by difficulties getting back to activities? Do they mean like fear-based difficulties, like they're worried about it, or do they mean they're getting actual physical symptoms?
Yeah, hey, I'm the one to ask the question. I am getting actual symptoms back, and I'm realizing I just think about these things a lot. And I'm going through the mindset module now, and I'm learning how to kind of cope with some of those things. But definitely, I'm still getting dizziness. And had a setback earlier this week, just trying to get on a stationary bike at the gym. And I think there was just maybe too much stimulation, but also I'm very conscious of not going over my threshold and trying to stay under that. And I feel like just that overthinking of my symptoms is maybe causing some of that. And, just kind of letting it happen, being okay with the symptoms that are coming is going to help. But I don't know if you guys had any other suggestions.
Yeah, I mean, like one of the first things you could try is just naming the fear when it shows up, or naming the anxiety or the worry or the overthinking. So if you're like trying to work out at the gym and you notice that's happening, just name it. Oh, right here, fear showed up, or overthinking shown up. Do I need to do this right now? Is this making things worse for me? You know, if it's hard to get out of that cycle, I often invite people to like move your body. So switch bikes, right? Get up, physically get up, move to a different bike, start again. And then if the thoughts come back, oh, there's overthinking again. This probably isn't helpful for me. Do I need to be thinking about this right now? Sort of like this repetitive reminder that anxiety doesn't have to show up in that context. That can be sort of like the first thing to try. It's not always effective, but oftentimes when we name it, there's sort of this catchphrase called name it to tame it, right? If we name what's going on, we really bring awareness to it and notice what's happening when it comes to, you know, overthinking, anxiety, any of these types of things. It really can just sort of slow it down in the body. The other practice that's really helpful for that is called the 3-minute breathing space, which you can find under the meditation module. And that just invites you to say, like, what's in my thoughts right now? What emotions am I feeling? Maybe it's fear, maybe it's worry. What's happening in my body? Oh, I'm tensing. I'm like really, really gripping in my body, or I feel like I'm going to make things worse and things are spiraling. Then it invites you just to say, okay, come back into your bellies. Can you do a couple deep breaths and reset? So it's sort of this sense of building skills to sort of work through what mental component might be happening in your thoughts and your experiences, so that it doesn't take away from what you're trying to do, right? You're trying to get on the bike. You're trying to reduce sort of that hypersensitivity, if you will, and start to move forward to build your tolerance that way. And just as you mentioned, right, when we are having these anxious experiences or overthinking, it's contraindicative, right? It ends up making things harder and more difficult. So that might be a place to start, and let us know how it goes. There's lots of other sort of tools in the toolbox that you can use, most of which are within the recovery mindset module. So I'm not sure how far you've got through yet.
Yeah, thank you. I'm about halfway through that. And I was curious if there's, like the second injury that I had, I didn't have like real symptoms afterwards. And like the week afterwards, I can't tell, or I'm not sure if I got a concussion. I didn't get actually checked out that day. Do you have enough information to say if it was a concussion or not? Or, if I did have a concussion, I would definitely be feeling symptoms directly after.
No, we can't say for sure. But what I always say, and this might be helpful, is how would things change if it was?
It's a good question.
Would you do
anything? I don't
anything?
think it would change.
What would you do differently?
Right. Nothing.
Because the treatment, if it was a concussion, is to work on calming the nervous system, to work on breathing, to work on the strategies that Melinda talks about, to work on diet, to work on gut, to start gradually increasing activity levels, right, to within symptom tolerance, and gradually pushing yourself beyond that and testing it every couple weeks. So the treatment is the same. And people get hung up on like, was this another concussion or was this not another concussion? And the answer is actually, it doesn't really matter, because whether it's a setback, meaning that something kind of triggered you, right? And if you watch that concussion cliff video, if you copy that link and take a look at that, the concussion cliff basically is like, you're standing at the edge of a cliff, and when you get a concussion, essentially persistent symptoms, like experiencing persistent symptoms, really is a reflection of what your health was prior to the injury. So if you are like young and healthy, you don't have any anxiety, you're not, you have no gut issues, you have no previous neck injuries, whatever, you get a concussion, it kind of shoves you a little bit, but you're not going to get PCS because your underlying kind of systems are already well balanced and everything is good. And so generally you have the normal recovery of like 7 days of symptoms and you move on with your life. But if you have some underlying anxieties and you have some neck dysfunction, maybe some gut issues, or whatever, now you're standing here. And when you get that concussion, you kind of fall off the cliff, right? And now you got to do all this work, and you've built yourself back up to the point where you're feeling really good. Everything's going well, but you're right on the edge of the cliff. So any stressor that comes along, whether it's another injury or you're trying to go back to work, or now you're like, am I going to be able to handle this? Like whatever type of stress, whether it's physical, mental, emotional, another fall where you're worried that maybe I did get another concussion. Well, now that's going to kind of push you back over, right? So whether it's a concussion or not, the same situation has happened because a stressor has come along. You thought things were good, but you're kind of still dysregulated because you're right here on the edge of the cliff. And now you have to kind of build back up again. So what we always say is like, when you get up there and you're still feeling good, you got to keep working on things to try and get yourself well away from the edge so that when a stressor comes along, it's not just going to shove you over the edge again, right? So you got to kind of keep working on some of these things. But whether it was a concussion, whether it was not another concussion, I hope that, everyone listening to this can just take comfort in the fact that it really doesn't matter, because a concussion, regardless, is a temporary kind of metabolic dysfunction. It's all the other things that make it a problem. It's all the other dysfunctions that make it a problem. So what do? Well, we work on those dysfunctions. We work on trying to do things that help us calm the nervous system, getting out into nature, trying to relax our minds, trying to ease our mind that this isn't really a big deal if it was another concussion, because it's trying to fix those underlying systems. Because if you get another concussion and you're back here, it's not going to matter to you. You're going to have a week of symptoms and you're going to go right back to normal, like a typical recovery is. It's when we're here that it becomes a problem. And so just maybe putting it out of your mind that like, you're not worried about other concussions. What you're worried about is just addressing the dysfunctions and trying to build resilience in your system. Because then even if you do get another concussion, big deal. You have a headache for a week or something and then it's fine, right? Concussion is not the problem. It's all the underlying stuff that's actually the problem. And so if we address that, you don't have to be worried about concussions ever again.
Right.
Does that make sense?
That's great. Yeah, it makes sense. I'll definitely take a look at that video, and I appreciate the help. I've only been in the program for a few days now, and I'm learning a ton. So thank you so much.
Great. Yeah.
Yeah, I wanted to add that piece about resilience, right? It really is just this idea of resilience building, which is sort of the cornerstone of the first couple pieces of that recovery mindset. Is resilience can be built, right? There are skills, there's evidence, there's science that shows us how we can actually build resilience, not only in our bodies, but in our mindset. So when we're thinking, hey, I'm always on the edge of the concussion cliff, what is that going to do for my life, right? It's not a negative. There's a lot of things we can constructively work on so that we're not standing on the edge of the cliff. And that starts really with our mindset and believing that it's, possible to sort of, re-equilibrate these dysfunctions, these dysfunctional systems that we talk about in our Concussion Fix pyramid. So really just starting out with this strong mindset, building that kind of growth mindset that you're probably somewhere there now if you're just starting out with the recovery mindset, and that sense of, I can do this, right? I can build this more resilient mindset so that I can really support the foundations of recovery, not just from concussion, but from whatever underlying issues might have been there before your concussion.
Awesome.
Let's go to the next live person.
I'm happy to see you guys. I have a question for Mr. Hrkal. I'm on the supplements since December.
Okay.
And I got problems with tingling in my feet, the soles of my feet and my hands, and it's getting worse and worse. And there's a vibration in my lower legs. And so it's like neuropathy. But neuropathy? What is it in English? I don't know.
Neuropathy, yeah.
Yeah, you're right.
There's a lot of these stuff is going on, and someone mentioned that maybe there's an overdose of vitamin B6 causing that. Is it possible? Because I tried to figure out how much the daily doses that I take, and it's under the maximum. And I was trying to find some information about it. But if you have too much B6 or not, what is it, to a shortage, then it's the same symptoms. So that's the question is what do I have to do with the supplement? And vitamin B12 could also be, when there's a shortage, then you have the same symptoms. So there's multiple options.
That's right.
I'm a bit confused now.
It is, yeah. So I'm going to say this. It's very rare to have excess amounts of B12 or B6. You need to take mega doses for months and months to really have that, we'll call it B6 toxicity or B12 toxicity. And one of those symptoms can be neuropathy. So I would say it's very rare. It's more common for people to be deficient in either B12, folic acid, or B6. Those are the three most common nutrients that are related to deficiency. So if you're taking them, the chances are that you're not deficient. The deficiencies of these vitamins really no longer exist if people are eating in the Western world, in the more developed countries, because there are a lot of foods that are fortified with these vitamins to prevent these deficiencies that were a problem 100 years ago, but now we actually don't need these things in our diet, fortified things in our diet anymore. I'd be thinking more along the lines of, number one, are you deficient in any of these things? So we talked about that. Number two, when you're coming to neuropathy, is there some sort of metabolic issue? One way that we could figure that out is you can do a comprehensive blood test to look at things like diabetes. High blood sugar can cause this, and that's easily checked out. So I'm assuming that you've had that testing done, right?
That's the first step then.
Yes. So if you haven't, that I would be looking at that. Now, sometimes people might be thinking, I'm not overweight, I'm not older, I'm no evidence or history of diabetes. It's still worth checking out. So that's the first thing you do. So you can check for basic deficiencies. So check B12. Check B6. You can check these folic acid. You can check these vitamins in blood fairly easily by your primary care provider. Secondly, ask them to check for diabetes, testing blood sugar, and something called hemoglobin A1C. It's a very common standard marker that checks for exposure of your red blood cells to sugar over time. So that's kind of the main metabolic reason. The third one, and this is, I know Dr. Marshall will have a comment about this. Whenever there's neuropathy, that's basically a word for nerve damage or compromised nerve function. So we start thinking about, is it equal in both legs? Is it changing over time? Is it going up your legs? Can you answer those questions?
It was more in the left leg, but now it's also in the right leg, and the tingling is getting worse and worse. It was started with my feet, and now it's also in my hands.
It's also in your hands.
Yep.
Is it going up your leg at all? And is there any pain shooting down your leg?
There is no pain shooting down. It's just the vibrations and the tingling feeling, and it's mostly the lower leg.
Okay. Because the reason I'm asking that is another cause for neuropathy is going to be some sort of nerve impingement, a fancy word for pinching of a nerve that usually occurs in your spine. So that would be your lower back, and then all these nerves come out of lower back. Is there any neck pain or low back pain? Because your neck pain will cause the issues in your hands.
I'm working on my neck for 2 months already with all the stretches and stuff, and I've been treated for my neck has been treated 2 times, I think.
Right. So what I'm talking about not so much is the treatment, because definitely sometimes treatment can make symptoms like this worse if the treatment is pushing on some of these impinged nerves. But because it's in both sides equally and it's kind of gradually coming on, what I'm thinking more along the lines of is there some sort of narrowing of the of a particular area that the nerve either comes out, or even the central canal, which is where your spinal cord runs in, which could be affecting your legs and your hands. So this would be what would be required here is an MRI of your low back and your neck. Have you had any imaging done?
Yes, but that's last June. They checked everything last year.
And did you have these symptoms at the time?
Not this ones.
Yeah. And how long have they been around?
The vibration started end of August, but it's up and down, and now it's getting worse and worse.
Yeah.
And I didn't pay much attention to it because they said it is a functional neurological disorder in my leg, so you should just neglect it. So I didn't pay much attention to it.
So that's what the neurologist said? They diagnosed you with a functional neurological disorder?
Yeah, and then they sent me home.
Yeah.
had
So
to
that was
fix.
going to be my question, because usually something like that, where you're having like a central stenosis or like a what's called CSM, you're going to have like more like motor incoordination type
Yeah,
symptoms rather than just
more
like
pain too.
in tingling. You're generally going to like, lose your feet in space and, that type of thing, these weird kind of nondescript symptoms. But if you've seen a neurologist, generally what they'll start looking at is doing nerve conduction studies to try and see like, is there impingement here? Is there neuropathy? And, at least hypothetically, they've done this and they're now diagnosing as a functional neurological disorder, which means there's no organic cause, meaning that it isn't true neuropathy, which generally points, like usually functional neurological type disorders, like functional cognitive disorders, are where there's no reason. So typically it points more towards like mental health and anxiety, because anxiety can cause this type of tingling sensation in the feet and the hands as well.
Vibration as well.
So what you always want to do first is you want to rule out the biological. You want to make sure, okay, we're going to check these nerves. Are they actually working properly? And so they'll do things like nerve conduction studies. They'll also test reflexes and sensory input and those types of things, which is a typical neurological assessment to try and see, is there something there? They'll do imaging on, low back and neck, just like has been done, and they say that that's normal. So once they rule out all those kind of organic, biological causes and find that there's nothing there, then it points more towards, like a mental health manifestation. Because what happens in these types of disorders is that our body's in such a state for such a long time that we start producing physical symptoms as a result, right? And so I've seen people that will have these altered gait patterns where like one leg, like almost like a hemiplegic gait, where they're walking where their hand is not moving properly and they're dragging a leg. And yet you'll do a full neurological assessment and everything's actually normal biologically. But it's kind of on the, I think the term conversion disorder is kind of what used to be used. I don't know if they still use that term anymore, but
it's been replaced by the functional neurological, FND.
Right.
Yeah.
Right. So it's essentially when it's like the mental health aspect gets so kind of overwhelmed that you start manifesting physical symptoms.
But you don't go to that level yet until you do the testing I wrote in the
That's
chat.
why you want to rule out all the other possibilities, right? Like
Yeah.
it may be worth getting repeat imaging. It may be worth getting a second opinion from a different neurologist.
Did you do the nerve conduction testing?
Yeah.
Y-
Yeah, but
you-
that's also in June. So that's, and then my blood was also tested in November, and then most of the blood stuff was
And
okay.
it was
So
normal.
Yeah.
If these are new symptoms, go back to your neurologist. Like if you never had the numbness and tingling, that vibration sensation, you can go back to your neurologist. Now, why did they diagnose you with that FND back then when you didn't have these symptoms?
because I had my left leg wasn't functioning well enough, and then still the sensation of both legs is still different. But I really trained a lot to get back to walking. I couldn't walk for a couple of days, so that's why I was in the hospital. And I really put a lot of effort on getting back to normal walking, and I can cycle now, and you won't see it. So that was
so you've like rehabilitated it. So that aspect.
Sorry again.
You've rehabilitated that like walking impediment that you had.
Yeah. So there was a different sensation. I didn't have the tingling at that point,
Right.
so that's why I'm puzzling now with.
So what I would try to do is I would try to get a referral maybe to a different neurologist, just a fresh set of eyes, rather than going back to the same one. Because if they've already in their mind labeled you as FND, they're probably just going to say,
for sure,
they're not going to do a thorough assessment. They're just going to assume that they were correct the first time and kind of maybe be dismissive. So try to get a second opinion. Try to get referred to a different neurologist. Explain the symptoms. They will do their assessment, and then see, because what you want to make sure is that you're just ruling out all the organic causes, right? Make sure there isn't something going on. Make sure the nerves are functioning well, because normally neuropathy would be like you'd have it in like one foot. You wouldn't get it like in multiple limbs at the same time, because then that points to more of a central situation. And then in which case they'll hopefully run imaging. And if that's normal and everything comes back normal, then they'll probably go back to the FND diagnosis, in which case you might want to see somebody like a physiatrist or somebody that specializes in FND. There's people that do this, right? Like I know that the one doctor that Dr. Hrkal works with is an expert in this area. She sees a lot of these types of cases where people have chronic pain disorders, FND, and so there are specialists in this area that can work on that specifically to help alleviate those symptoms. But I think first step, try to see a different neurologist, get a second opinion. Hey, I want a second opinion. Things aren't working. And then hopefully they'll do a thorough assessment. And if there's something there, then they can provide the right treatment for you at that time. If there's nothing there and they go back to the FND diagnosis, then I would try to find an expert in FND, because that's a whole subcategory that requires, like, generally it's a multidisciplinary kind of team approach, like what happens at Dr. Hrkal's clinic. And that's the best place that you could be, because they'll help you with that.
For sure. There needs to be psychology brought on board for that. There needs to be the manual rehabilitation side, which I know you are trying to implement through the course. So like, I think the Concussion Fix course is a great foundation. But like ultimately, the reason you're asking this question is that you want to figure out what's causing this. And we've given you a blueprint to do that. And I think it's a great idea to get a second opinion, if that's even possible. If the family doctor is willing to do that. And then also the last thing, the takeaway is that if you feel like, if all this other information comes back again negative and there's no other possibility after ruling out the metabolic and then also the structural issues, then we have to think about this as a functional issue, which is going to be treated with a multifaceted, multidisciplinary approach. And that's where the psychology becomes so powerful. I don't know if, Melinda, you have any experience with FND from a psych perspective.
Yeah, I mean, there's some interesting, like, interesting is the only word that's coming up. There's just some like very interesting symptoms that can come up with conversion disorders and functional neurological disorders, things that don't make a lot of sense, right? It's just like, hey, why is this symptom arising? So, from a psychological perspective, in my experience, it's working on mind-body, right? Reconnecting mind-body. Sometimes there's a bit of a trauma history, so recognizing what those triggers might be and how the body can manifest some of those traumas on the outside. So there's a lot of work that can be done, absolutely, from like a psychological perspective. And really, people that experience FND, there's different types of disorders in that diagnosis. They want to try to make sense of what's happening to their bodies, because a lot of times the symptoms don't make sense, right? And they just seem out of context and there's no reason why. And so that can be really discouraging and almost add to the individual's suffering and make things a lot worse. So the psychological aspect of that as well is recognizing that, hey, even if there isn't like a certain etiology of origin of where these symptoms have come from, is there a way to help you make sense of what that is? Right. And there's all sorts of different psychological therapies that could be so helpful and supportive for that. Is it functional medicine doctors, Dr. Hrkal, that also kind of addresses the movement side of it? Like, I know there's been these really interesting experiments. There's been books written on this where they kind of put a mirror out and like retrain the brain on how to move two legs in sequence again when one leg just doesn't resonate in the way that it's supposed to and doesn't align the way it's supposed to. So there's a lot of kind of neuroscience to it as well that extends beyond the psychology piece. But again, just as the way our concussion pyramid is laid out, the first is always mindset, recognizing what those psychological underpinnings are, because there could be a lot of things contributing to these symptoms manifesting, even if they don't make logical sense right now. And then sort of building on, well, how's the brain interpreting this? And, how can we remap those pathways to provide you with superior functioning and regaining your functioning? There's just so many reasons that this could happen. So just like Dr. Hrkal said, and that's kind of what I was thinking as well, is it's very multifactorial. And it's almost, I really like what Dr. Kim and Dr. Paul were sharing with you, go back to the neurologist, make sure that there isn't something else, causing this, and then move into, okay, if it is FND, where do I start? How do I build my provider network so that I feel supported from all aspects, psychological, neurological, and other, physical therapy and so on.
Yeah, I've seen a psychosomatic PT, and they're doing actually a lot of trauma release work as well. Just so I'm on all the. So maybe I'm doing too much. I don't know, but I'm.
Well, yeah, these somatics, right? Trauma release and somatic therapies and movement therapies, they often have a lot of really powerful, like beneficial results. It's coming more and more. It's becoming more and more well recognized and well documented. So they're always worth a try. I mean, pacing yourself so you're not doing too many different things at once. But I think that sounds like a good path.
I was redoing your module as well for the second time, just to go over it again and see if I missed something. So, yeah. But thanks a lot. I did made a lot of progress on the program. It's now that I'm on some kind of steady line, and this is a new thing happening for me. So that's why I wanted to ask the question. So,
it sounds like from the treatment you're getting, like you're already kind of doing the things that we would recommend doing for FND anyway. So I would just say, like, some of these things do just take time, and just be patient with that. But I would encourage you to try and get a second opinion on the neurology front, just to make sure that nothing was missed.
Yeah.
Okay.
I'll go for that. Okay. Thanks a lot for your help again. I really appreciate it.
You're welcome.
I think that's a great spot to wrap it up. So thank you everyone for coming on today, and hope everyone has a fantastic day.
See you later, everyone. Have a great day.
Thanks for joining us. See ya.
Thanks, guys. Bye. Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful, and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.